Hello and welcome to Aging Matters, the Berks County Area Agency on Aging's show. I'm Katie Catchmark. I'm the Deputy Director of the Berks County Area Agency on Aging. Today we're going to talk about substance use among older adults. Substance problems among older adults often go unrecognized and untreated due to a variety of reasons, including stigma, denial, and shame. These problems are often associated, most often in seniors, with alcohol and prescription drug misuse. Some key issues for older adults experiencing these problems are health, social inequities, social isolation, stigma, and discrimination. So today I'm very pleased to introduce my guest, Marcia Goodman-Hinnershitz. Many of you may know Marcia as a 5-term representative of Reading City Council for District 2, but may not know her as well for her work with the Council on Chemical Abuse. Marcia has a Master's of Social Work from Temple University and has spent 30 years with COCA doing a variety of things. Currently, she's the Director of Planning and Resource Development, and in this role is constantly advocating for prevention and education. So thank you for joining us, Marcia.
And it's a real pleasure, a good topic we need to discuss.
Absolutely, thank you. Before we jump into the topic, can you tell us a little bit about COCA and what their work is?
Yeah, the Council on Chemical Abuse is the coordinating agency for drug and alcohol services in Berks County. So we oversee an array of services from prevention, intervention, treatment, and recovery support. And we're there to be able to address what are the pertinent issues facing the population in Berks County. So we provide services from birth all the way through aging populations.
Right, and so when we talk about substance abuse, what does that encompass?
Okay, when we use the word substance abuse, we're really speaking of people who use substances, whether they be alcohol, other drugs, prescription drugs, and use them to the point that they're a detriment to their health and well-being. And it's really termed substance use disorders, because when a person develops a disorder due to their substance use, they need intervention and treatment.
And I think that's sort of an interesting generational change as we talk about seniors, this idea that recognizing it's actually a disorder.
Right. And so when you look at other disorders, you might have a disorder such as diabetes. People have heart conditions, and a lot of them are linked to substance use disorders because when you're using a substance inappropriately, it really aggravates the development of a lot of those other illnesses. They're all correlated.
And so when we're talking about seniors, what type of substance abuse or misuse are we seeing?
Well, we're seeing misuse from all the range of what we refer to as the Council on Chemical Abuse, all the range of chemicals, from alcohol being very prevalent among seniors, this misuse of prescription drugs, and especially now we're very concerned about the painkillers, the opioid drugs being a prevalent problem with older adults.
Right. And so I think sometimes when we think of middle-aged people, that we're mostly thinking about drinking, but as you said, this really can be much broader than that. I actually read the National Institute on Health in 2019 said that the rate of chemical abuse in people between 50 and 64 has increased by 25%.
Well, I think what's important to note is when you look at prescription drugs, the majority of prescription drugs are used by people over the age of 55. Okay, they're being prescribed for a number of different reasons, and because they're being prescribed, people don't always follow what their doctor's instructions are. They might not consult with their pharmacist, so there's a much higher rate of misuse, which then can lead to abuse.
So as we start to see this increase with seniors, what are some factors that contribute to that substance abuse?
Well, first of all, I think people may not be informed consumers. So when they look at whatever they're using, whether it starts with alcohol, they may not look at, for instance, alcohol as a depressive drug. If it's used in conjunction with other drugs that are prescribed or even over-the-counter drugs, there can be some fairly deadly consequences. And they forget that these drugs all affect their kidneys and their liver. And as you're getting older, those organs are being more compromised because they're getting older too with your body, so that they can't tolerate the level of use that they might have when you were younger.
And so I think also with some seniors, there's probably some interesting risk factors like entering retirement, having more time at home, or the social isolation. Do those sorts of things contribute to this type of abuse?
Well, for sure. Okay, so first of all, if you have more time, you're also possibly, as you're getting older, your body is going to be in a lot more pain. Okay, and so people have different levels of pain that they can tolerate. So they may choose to, first of all, use over-the-counter drugs and not really read the instructions. A good example is the Tylenol. Okay, you're not supposed to be using that for any extended amount of time, but many people do as a way of handling their pain because it compromises your liver. Okay, it compromises your kidneys. And then people may be prescribed opioid drugs for pain, and they may not look at the fact that those drugs you can become addicted to very easily. Okay, and it's not your choice, it's what happens within your body. Your body develops a tolerance and needs those drugs to be able to address the pain. So it's very important for, as you're in retirement, to say, okay, I need to commit to a plan of health, and look at who your primary care physician is, making sure you're asking the right questions and being prepared for the fact that your body may not tolerate these drugs. And your loved ones may not always know that what's happening to you, that you may be developing a substance use disorder.
So I think that's a really interesting point, that often I would think in terms of someone who picks, drugs or alcohol and uses them in excess. But when we start to look at multi-medications, a lot of seniors are on polypharmacy, a number of medications, or as you mentioned, how medications interact with each other, or if you're drinking along with taking some medications.
Yeah, and so if you read the instructions on the majority of medications, they're telling you you're not supposed to use alcohol in conjunction with them. Okay, it's just a simple thing. The developers of the pharmaceutical products know what the limitations are, so you have to be very mindful. What I think is interesting, though, if you look at those instructions, they're very small print. There are a lot of information that people probably aren't willing to read. And one of the pieces of advice that we always give is work with your pharmacists. They're the real experts. They're the ones that can tell you how drugs can be mixed together, and to be able to be honest and be able to be an informed consumer. Because I don't think people choose to develop a substance use disorder, but it can happen very quickly and get out of control very easily.
And I think a lot of our attention sometimes seems to be focused on younger folks, and so it may not be as simple to recognize in seniors. I think maybe people often, it comes out at work, not performing well at work, but for someone who is at home, more social, more isolated, maybe doesn't have the same expectations. So what are some factors that concerned family members can look for if they think someone potentially has a substance use problem?
Okay, I think they need to look at the same thing you look at for anyone. Is there changes in behavior? Okay, is there more isolation? They need to look at what's in the home. Okay, are there a lot of medications? Need to look at, what the alcohol use is, and to be very caring when they're approaching someone, because there's going to be a lot of denial that comes from any kind of conversation. So you really need to be caring and loving and not judgmental when you're asking questions about someone's use.
It's a good point. And how would families distinguish, I think some markers of maybe substance misuse might overlap with some signs of normal aging, trouble sleeping or low energy or sleeping too often. How would you suggest that families try to figure that out?
Well, I think what's important is family members don't want to do it solo. They want to be able to work with the primary care physician, okay, to be able to talk about what might be happening. And it may be asking to accompany the older adult in their medical appointment, to be able to be honest. And also know that the doctor's not going to be able to share any information with you without your parents' permission. So if you're working with an older parent, you need to be able to ask to go to the appointment together with them, and then be able to ask permission, can I sit in on the appointment?
So anticipating that some people may resist that, what are some stigmas that people face when talking about these issues?
Well, first of all, there's a lot of shame that goes along. People do not want to be able to look at the fact that they're not able to control everything in their lives. So they may be feeling shame, a lot of denial, okay, and that's a lot of the stigma. And what we also find is there is a stigma just related to the fact that you may have a problem. What I think is interesting is there's not nearly the amount of stigma with diabetes as there is with substance use disorder, but they're very similar diseases. Okay.
So how can families or involved people, how do you help reduce that stigma?
Well, first of all, I think you need to be informed about what the disease entails. That's why the Council on Chemical Abuse, we keep a very vibrant website, cocaberks.org, and we ask people to go on that website, read the information, become informed yourself so you understand that this is a disease and not to be able to be pointing fingers or blaming people for the fact that they have an illness. Again, people don't blame diabetics for the fact that they might have developed a disorder related to their sugar use, okay, but unfortunately people have a real tendency to blame people when they may have a substance use disorder.
How accessible is treatment for seniors with substance use disorders?
It's very accessible, and what's really fortunate here in Berks County, through Care and Treatment Services, there's actually a special treatment track for older adults, because there is a recognition that the treatment may need to be different, so that we focus on the needs of the older adult. And so if you go on our website, cocaberks.org, you'll find the listing of our treatment resources and how to connect with them.
Terrific. I actually was not aware that Karen had that special track, so that's wonderful news. Is that something that insurance often pays for?
Definitely. So it's important for, individuals when they go into treatment will be asking information, just like when you go for any kind of medical care, what's your insurance. So you need to be aware of what your insurance is, and individuals that are uninsured or underinsured, COCA can provide funding to support the treatment.
Oh, terrific. And so I think another barrier for seniors may sometimes be sort of this ageist idea of their aging, let them have an extra drink if they, excuse me, if they want it. How do we combat some of that mentality?
I think what we need to do is be aware that anything that we put into our body can be harmful if we're not able to tolerate it. And I keep going back to the livers and the kidney. Okay, a lot of people that are in late stages of alcoholism have cirrhosis of the liver. There's a lot of signs of that. But it's really important to be working with your primary care physician and be treating anything that touches your body, and have them be doing the testing that's needed to be able to identify problems early on before it becomes too late. Because the sad part about it is if it's not treated, you can die of toxicity without even meaning for that to happen.
I think something we see with seniors is that they don't metabolize these medications the same way. They can stay in their system longer, and you have these kind of unintended consequences. And I think that also comes into play. You've been talking about diabetes, but I also think with blood pressure, dizziness, likeliness to fall, and it can lead to all these other consequences that can really become life-altering.
Yeah, and all these medications have side effects, and unless they're monitored, unless you have good communication with your healthcare providers, they can be very dangerous.
And so experts recommend that older adults have no more than 7 alcoholic drinks per week. And I think when we start to talk about that with mixing medication, and I think that comes into sometimes people, maybe we don't recognize the difference between that misusing medication can also be as dangerous as abusing it.
Oh, definitely. Again, the medications should be taken as prescribed, and I ask folks to read those directions. Again, sometimes it's small print. You need to be able to review those with your primary care physician, anything that's prescribed, so that the side effects can be explained, and when you know that you may be having a problem. Okay, so that it may be just overuse of a certain medication. For instance, people might say, well, the medication says I can use as needed. no, there's only a certain amount of that particular drug that you're supposed to be using per day, per hour. And those drugs are not made to be used, especially the opioids, as needed. They're supposed to be used as instructed.
And so there's a lot of tools to help seniors or people of any age manage their medications. We brought this one along. Can you just tell us a little bit about this?
Yeah.
Get it open.
So it's very important to make your medication use easier. This is a pill box. A lot of people are familiar with these. But basically the way this is designed is you take the pills and put them as used, as directed per day. So this is Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, your morning medication, your noon medication, your evening, and your night. And everyone has a particular pattern of medication they're supposed to be using. It's very important, but it's also important to understand what medications are what. So when you take them out of the bottle, you're not identifying the medication, so you need to know and keep track of what medication I'm using during each time of day.
Great, and actually I'm going to get a good view of this for the camera and also show these pop out, which is really handy. So
Right.
if people have, I should have picked one that's color so you can see it, but if you have arthritis, you can use one at a time and open these. And there's all sorts of varieties of these available.
Right. And then one of the things that's unique, if you close this here, and can you hold it up
Yep,
to
sure.
the camera? Our QR code to our website is also included in that if you scan that, you can then be taken to the website with information about safe medication management.
Oh, terrific. And so other ways that people can help keep their families safe with medication, you know, managing their medication, but what if someone has someone in their home that they're concerned about may misuse their medication? You know, obviously, you know, an anti-anxiolytic or an opioid in the home.
Okay. Well, the one first important fact that I think if you're prescribed opioids, and we communicate with all physicians about this, it's important also to have one in your home, and you can hold this up for the camera. Okay, this is the pouch that contains Narcan, and I'll open it up and show you what it looks like.
So we get a shot of this on the camera.
Okay, and this is the nasal drug that you can use if a person has overdosed to be able to reverse the overdose. And fortunately, we can provide Narcan to anyone that asks for it in Berks County at no cost. It's also available over the counter now, but it's very expensive. It's $40 for a box like this. Okay, so the Council on Chemical Use wants to make sure that Narcan is in the hands of anyone that's using an opioid drug because they might be at risk for overdose without really meaning to. They might take too much medication, and it's important for loved ones to know that if their parents are using opioid drugs, that they might need to have it available for them if, again, there might be a possibility of an overdose.
What type of training does someone need to use Narcan?
Okay, well, the training's very simple. We have it online that people can go and click on our link, and it gives you instructions step by step on how to administer Narcan. And to be able to understand, there's two important pieces. If you're administering Narcan, you need to call 911 to make sure that the EMS get to your home, and to also understand that it's safe to use, that if someone isn't using an opioid and has an overdose, it doesn't hurt to be able to, if you feel the person's unconscious, to be able to administer, there will be no side effects.
Oh, so if you're unsure if they overdosed on an opioid or if it was something else, you can still give this?
Right. And it's on being on the safe side, but that's again why it's important to call 911 and get the EMS out there right away, because they'll know the next steps to take to be able to help, and they will transport the person to a hospital emergency ward so the appropriate medical care can be given.
Oh, great. That's terrific. And you said people have access to this by contacting COCA.
Right.
That's a wonderful resource. And then in terms of keeping medications safe, I see you have a lockbox here that can be used.
Okay, and if you want to hold that up to the
Sure.
camera. Okay. So it's important to be keeping your medications safe and locked because you don't know who might be coming into your home, whether they be grandchildren, other family members. So we want people to be able to lock up their medications and then be able to access them as needed. And so we provide, again, these lock boxes at no cost for individuals to take into their home. And we have a large demand for that. A lot of the pediatric practices work with us so that the children in the home are protected. Unfortunately, people may also, if they have a card to be able to access medical marijuana, a child may access that and try to use or eat that, so that it's important to be able to have that locked up as well.
And these are also available through COCA.
Right.
That's terrific. Are there other techniques for people to keep their medications safe in their home?
Okay, so it's important, first of all, an interesting piece of where you put your medications, you should put them in a place that's safe. You shouldn't be keeping them in the bathroom, which is where people most likely keep their medications. The reason for that is the high humidity in your bathroom actually is dangerous, can destroy the effectiveness of the medication. So then you need to find a place that you can reach that's safe and out of reach of children. It's also very important in medication management that a lot of times your medications may be discontinued, you're done using them, is to dispose of any unused medications on a regular basis. It's like doing spring cleaning. We really should be doing it on a monthly basis. Say, okay, am I no longer taking that medication? And then I need to dispose of it.
And so I know you brought us a way to dispose of it. I'm going to make some room here. It's a little bit of a science project, right?
Right.
So tell us about what's in these bags.
Okay, I'm going to open up one of these.
Yep, that one. I took the top off.
This one?
Yep, I took the top off of that one
Oh,
already.
okay,
Yep.
so it can be opened, okay. Good. And I'm actually going to take out what's in here, and then we'll do the...
Great.
Okay, so you can show that to the camera. So the medication disposal bags contain a way of safely destroying unused medication. We do have drop boxes all across Berks County at every one of our police departments, other locations. The people can take quantities of medication, but if they have a small amount to dispose of, they can use these medication disposal bags very easily. And I believe we're going to conduct an experiment to be able to show how. So let me just put this back in here.
Well, I guess before I put this in, why is it important that people dispose of medications this way and not just put it in their trash can?
Okay. First of all, if you put it in your trash can, it's going to go to the landfill. The landfills then affect the environment. People also tend to flush medications down in the toilet. That goes into our water supply. And so it really poisons the waters. There's actually been studies done that show it impacts the environment. Fish and such will be impacted by the fact that there's chemicals from these medications that get into the water supply. So it's better to be able to dispose of them effectively. And by using the medication disposal bags, they contain charcoal, which is the way that you can safely dissolve the medication without harming the environment. And when the medication is disposed of and dissolved, it then can go right into your trash. And this is an environmentally safe pouch.
Okay, great. And then you also know no one's going in your trash for it.
Right, yeah.
Okay, great. All right, so we can put this in here, and you can put, I think, 45 pills in there.
Right.
And then we add warm water.
Mm-hmm.
Okay, well, I didn't pour that very well.
Okay,
but
and if you feel the bottom of this, it's starting to get warm.
Oh, I'm sorry.
Okay. And you're having a chemical reaction occurring that's dissolving the medication.
Oh, I hear it. Okay, so it's fizzing.
It's fizzling. Yeah, that's why I call it a chemical.
Yep.
And if you look down in it, yep, you can see a little steam coming up.
Oh, terrific.
Okay.
I don't think they can get that on camera, but trust me, it's a fizzy mess in there.
Uh-huh.
And then so you would just seal this up and put
Right.
it in your trash can. Terrific.
And then we also have a couple different varieties of these for people who have loved ones that may be prescribed a fentanyl patch, and then they pass on. A lot of those are used for treatment of pain from cancer. Okay, you can, the larger ones, you can put a fentanyl patch in there, do the same kind of procedure, and it dissolves the fentanyl patch. You want to be able to dispose of them as soon as possible after your loved one has passed. Okay, you don't want those out because they can be very easily abused.
That's great advice. So really talking a lot about how we store the medication, store it properly, take it properly, and dispose of it properly. In our last couple of minutes, I just want to ask, how can families be the most supportive to seniors in this?
Okay, first of all, it's important to be non-judgmental and to be caring and loving, and to be working with the person and not be so concerned about controlling their behavior, to be able to let the person know you care about them, but also to be expecting there's going to be some pushback and there's going to be denial, and not to be taking it personally, but just to be giving them as much love and care as you possibly can, and to be getting support for yourself. So as you do this, you don't try to do it on your own. And that's why the Council on Chemical Abuse is available. We can give you the support of family recovery support specialists, people with lived experience that can be guiding you through the process of how to get help, and also to deal with the frustration and pain if the person isn't willing to take the guidance that you're offering them.
That's all terrific information. I really appreciate you being here with us today, and all the work that COCA does in supporting people of all ages who are living with substance abuse disorders, and as well as supporting their families through this. So it's really terrific work.
And it's really important that we do collaboration with the Area Office of the Aging, with Berks Encore, with all the resources, because we can't do it on our own. We need to connect with people that can provide the strong partnerships and support to get our message to the community.
Terrific, terrific, yeah, and we really appreciate that partnership. So again, I want to thank you for being here with us today, the Council on Chemical Abuse for all that they do. And again, this is the Berks County Area Agency on Aging show. Thank you very much for joining us today.
Thank you.